I'm happy to have the opportunity. I am going to talk about trends in end-of-life planning. And, I think that what I'm seeing is that the way that we approach death is changing. And hopefully that makes sense. The way that we're aging and the way that we're living is changing. So I think it only makes sense that the way we approach death is changing. And that's my topic today. So when I say the way that we're aging is changing and the way that we're living longer, and many of us are living with more serious illness for a longer period of time than ever before. I'm experiencing this myself. My name is Karen Purze. I run a website called lifeinmotionguide.com. I started this after my parents experienced sudden and simultaneous medical emergencies or medical crises, and one of them a long-term crisis resulting from a stroke with my mom. So with the site, I focus on helping people prepare and make end-of-life decisions and preparations so that they can focus on what matters most at the end, which I think is people, not paperwork. So I know many of you work hand in hand with clients and patients and care partners, and may not spend as much time as I do looking at end-of-life planning kind of at the macro level. So what I plan to do is go through some of these trends that I see, and also maybe some of the implications for your own businesses is something, give you some food for thought on that front. So first of all, part of a broader trend of moving care away from hospital towards home, we see now more people dying at home. In 2019, more people died at home than at any time in the last 50 years, according to an article in the New England Journal of Medicine. So this has been fueled by the availability of hospice and also a cultural movement to reclaim and de-medicalize death. And experts say, and I think we can all kind of assume based on demographic trends, this will only continue. So if you're in the field, whether you're in senior living or patient advocacy or home care, prepare for even more collaboration with hospice is one of the implications of this, I think. Another change, and hopefully this won't make Karen's head explode, but is a shift away from focusing the advanced care planning conversations around the documents that are needed and moving towards discussions. In 30 years, over $300 million is spent in research around how to increase the adoption, improve outcomes for advanced care planning, and the needle has not moved. Still only about a third of people complete advanced care planning documents. And Dr. Sean Morrison, who is a physician and palliative care doctor in Mount Sinai, as well as the director of the National Center for Communications Research, Palliative Care Communications Research, recently wrote an article or an editorial in the Journal of Palliative Medicine titled Advanced Care Planning, Clear, Simple, and Wrong, which is pretty provocative, right? That's thinking, how can we think differently to help people in these moments or in these times when they are faced with difficult decisions at the end of life? That's what he's proposing. He's encouraging a focus, instead of focusing on the documents or focusing on the idea that everyone should be completing their advanced care plans well in advance of the need. He's saying focus instead on helping families make real-time decisions, where real-time in his definition is when death moves from hypothetical to possible. So it's not abstract anymore. So that's, I think, a really interesting, so the idea of moving away from documents is kind of, I mean, parallel to the document discussion. You often see a focus on this conversation around decisions. So what documents do you have? What decisions have you made? What interventions do you want or not want? The Society for Medical Decision Making posted an article, a paper recently that was proposing moving away from this idea of rational choice in these decisions towards value awareness, which I think is a really interesting shift. Dr. Rebecca Sidori, who has dedicated her life to advanced care planning and advanced care planning research, is a professor at University of California, San Francisco, and a geriatrician and palliative care doctor there. doesn't agree with Sean Morrison, but also does support the idea of, and I think this is fascinating, advanced care planning as a longitudinal conversation to help surrogates prepare for in-the-moment decision-making. So it's very different from, hey, everybody, as an individual, you should create these documents and make these decisions and share it with someone. So a longitudinal conversation focused on the surrogate, preparing them to have the conversation in real time with trained medical staff. I think it was really very interesting. Professionals, I'm seeing now training that's focused on leading people through these conversations. So people are being trained to ask questions like, what does a good day look like for you? What matters most to you? And having that be the way towards goal concordant care, but also as a way towards outcomes that people feel satisfied with, if nothing else, right? And satisfied is not the right word, but towards the, quote unquote, right outcome. So I think these two things I think are a fascinating shift towards conversations and preparation, as opposed to leading people to believe that maybe they could make a final decision now, well in advance of being in the situation. Another trend you may be aware of, it gets talked about in the popular press as well as I'm sure you've all experienced this, is a move away from burial towards cremation. This has been accelerated by COVID. The National Funeral Directors Association published their report this year projecting a cremation rate of 80% by 2040. It's already over 50%. That happened in 2015. The reasons are sort of a rejection of this idea that a funeral should cost an average of $7,000, but people also needing the flexibility with distributed families or with COVID restrictions, needing that flexibility to hold memorials at the time and place of their choosing. Decline of religion, environmental concerns, all of these are some of the drivers for really what is a pretty rapid shift towards cremation. And new business models are arising from this. So Solace Cremation is based in Portland. They also have operations in Seattle. They offer flat rate cremation with all of the paperwork done online. They're also now expanding, and they're expanding to, as an example, Los Angeles. And what they're doing is partnering with a local crematory. Solace manages basically owns the customer and the technology. The local crematory handles transportation, handles the cremation and the return of the ashes, whether in person or by mail. Totally different model than what's done today. Maybe not totally, but it's significantly different. And take this from the CEO last week in an article wrote, we've removed the physical idea of a funeral home. So I think that's pretty provocative if you consider how this change is impacting the death care industry, but also where else might the physical idea of something change as a result of some of the trends we're talking about. So that's sort of food for thought. I see a shift away from the medicalization, from the idea that death is a medical emergency, the idea that death is something that happens in hospitals, and towards people sort of wanting to take control of this rite of passage, making this passage on their own terms. And I think part of it has to do with that that stat I said earlier, where there's almost 10 years where people are living in poor health. And right now, if you think about it, there are many, many baby boomers spending their early retirement years caring for serious ill parents and wondering if there's another way to go about this. The discussion, there's a lot of discussion around a gentle death or a good death or a death that reflects the life and values, and people being a lot more proactive about what that means. Something else that's getting a lot more discussion, I'm happy to see, is the disparities, the disparities between how end-of-life planning looks for racial and ethnic minorities, and what, not just the disparity is well documented. What I'm seeing different this year is a lot more wide-ranging discussion about why that is. I see organizations self-examining their bias around issues of access, around communication. I see a lot more focus on language, on cultural sensitivity, on the role of religion, something doctors don't always acknowledge, the role of religion in these discussions. And importantly, a lot of the default is that these conversations are assumed to be kind of an individual decision. That's the default in the healthcare space. A lot more focus now on being sensitive to the fact that for a lot of people, this is a family decision. It's a family discussion. So I think that's a really kind of interesting development. I went last week to the Coalition to Transform Advanced Care Planning National Summit, and this was the theme of the entire 3-day event was equity, and there was a lot of discussion there, but also people demonstrating kind of results of how their organization approached the analysis of not just what and the fact that it exists, but how it exists, why it exists, how to root it out. So I think that was pretty interesting. So I see a ton of innovation in this space, and so it's the status quo is no longer, and we are seeing a ton of innovation in technology, which I spent my whole career in software development until 4 years ago, and you'd think I'd be more interested in the technology side of things, but honestly, it's almost the least interesting. There are there are digital tools proliferating both in the B2B and B2C space in end-of-life planning, whether that's guiding people through the process, whether it's documenting their wishes, whether it's getting organized. There's a lot of tools available, but I see a ton of innovation in healthcare. There have been codes for allowing doctors to get reimbursed for advanced care planning conversations, codes available since 2016. But next year, I'm also seeing now new models for integrating hospice into Medicare Advantage in different ways. So that's an experiment or a model that's taking place starting next year. And there's at least 6 others that are innovative experiments into how to support people with serious illness at the end of their life. So healthcare is, I think, changing, and there's some interesting things happening in insurance as well. So the Society of Actuaries is doing research into consumer research into different kinds of combination products. One which is a term life insurance policy that converts later to long-term care in your later years. One is a retirement product like a 401k or an IRA that combines with long-term care insurance. So some interesting innovations there. In the legal area, many states have now enacted laws that make it permissible to notarize by teleconference, do electronic notarizations, lots of things that make it easier to formalize decisions in legal documents. So I think I do see a ton of innovation in this space, and that really is like the big takeaway for me, if you take away something from this little short presentation, is that this space is changing as fast as we're aging. And I would expect our customers to request new and different types of service referrals. So I'm really grateful for a group like this where it is really all about kind of getting to know each other and what each other does and what we offer. I think examining our networks and seeing where there might be gaps in light of some of these trends might be something that you could take away. If you want a link to any of these things or want to see some of the papers that I cited, go ahead and send me an email, Karen@lifeandmotionguide.com, and I can send you some of the reference material for this presentation. But that's really what I wanted to share today. So thanks for your time.